very intrigued about what our Business Spotlight guest has to say today, because as many of you know, I'm a big proponent of physical health, mental health, emotional health, and all of the things that can allow us to thrive in those areas. And if we're not paying attention to the things that can handicap us, then we're not going to be able to perform at any peak level, let alone thrive. And there's a lot to be said about our conversation earlier about fear and how fear can certainly, and the unhealthy fear can certainly take away from your performance and take away from the joy and the excitement that you can draw from life in many areas. But there's also physiological areas that can take a toll on your performance, and it has nothing to do with an emotional state. It has to do with a physical state. So on the line today is Dr. Johnson. We had Dr. Johnson on the show, in our inaugural show. We had him, and there was so much information that he gave us that I asked him to come back again and share with us yet another portion of his knowledge with us as it pertained to brain health and all of the things that we need to be mindful of in order to have good brain health, and what it and how it's affected by outside and external circumstances, sometimes internal too, but also external. So we're going to spend our Business Spotlight chatting again with Dr. Johnson, because he is a wealth of knowledge. And if you haven't had a chance to hear the first show when he was on, I encourage you to go to the archives and listen to Dr. Johnson. But he's a 40-year veteran in medicine. So the man certainly knows what he's talking about. He's here in Richardson, Texas, running a very high-tech facility called Johnson Medical Associates. If you haven't had a chance to check him out, I encourage you to check him out. But let's dive right into it. Dr. Johnson, thanks for being back on the show.
Oh, it's my privilege. Thanks for having me.
Oh, absolutely. Let me ask you, can you share with us how important is brain health, and what are some of the things that we need to be mindful of based on your knowledge and your expertise?
Well, just as you stated, your brain function is very important. If you don't have your brain, can't think, you really aren't here in this world. Your body may be, but your mind's not, and your mind's our most important thing that we have to function with to make living worthwhile. So today what I'd like to talk about is those things that are in our environment that can affect our brain. As you stated, the psychological type things with anxiety and fear short-circuit our brain so that it won't communicate properly, and therefore you can't think. Your short-term memory may be bad. Executive function may not work well because those pathways that you normally use are blocked by the other emotions that are going on. So I see a lot of people that have had different types of environmental exposures that affect the brain. And these can be pesticides. Pesticides are neurotoxic. Other things are volatile organic compounds, which are like solvents from paints or cleaning products. They can be fumes from combustion products that affect the brain. One of the things that are very, very common is we have mercaptans, that sulfur smell that's put in our natural gas, because natural gas is a neurotoxin. If you breathe too much of it, it will kill you. So those are things that we look at and want to be aware of as we live each day. Different hobbies can be a problem. If you use epoxies or epoxy paint, those chemicals in that can affect your brain from that standpoint. So there's a whole host of these environmental things that I look at, I deal with on a daily basis to help people feel better, function better at a higher level. Sometimes it's just past history of concussions where you had a brain injury. You didn't really realize it, but does affect the brain. That hinders your executive function, hinders your memory process, and you may be already functioning at a high level, but you can reach a higher level.
So what do you find in your experience dealing with folks who have their challenges. What do you find becomes, let's say, a top 3 physical challenges that people struggle with, brain challenges that people struggle with, that does present a problem in performance? And what are the 3 causes? Because there's many, right? You just mentioned a bunch of them. But the top 3 that you find, what are they?
Well, one of the top ones is concussions or head injuries, and it may be mild ones that you don't pay much attention to, but have affected your brain function. And then the question is, well, you may recognize you aren't functioning well, or you may not, but how do we determine what's going on? There is a technique of looking at your brain waves, which is called a QEEG. It's a digitalized EEG, looking at your electrical patterns in your brain, and it actually sorts out the connectivity between the different areas of your brain to see whether they're functioning normally or not. And there's patterns that relate to concussions. There's patterns that can relate to anxiety. There's patterns that relate to toxic effects. And so with a really good quality quantitative that's QEEG, you can look at what these brain patterns are and then sort out what is actually going on, and then a treatment program can be organized and set up to help you regain function that you've lost.
So can a person, doctor, who is not feeling right, and feeling right is I say that in a very simplistic term, but someone who knows, hey, something is not right with me. I'm struggling either with a sense of overwhelming fear or overwhelming discouragement or a lack of focus or an inability to manage their moods. Anything like that, really, that a person can struggle with that falls under that category of I'm not feeling right. So you're saying that based on a person's brain waves and electrical status, that they can pinpoint to an extent what the problem is and what could have caused it?
Yes.
That's excellent.
Yeah, it is. And it's technology that is out there that we utilize on a daily basis to look at underlying causes. You can get counseling forever, which helps you deal with what the situation is. My goal is to look at what the underlying factor is that's affected the brain, and whether it's a concussion or whether it's some abnormality like in your neurotransmitters, there's serotonin, epinephrine, norepinephrine. We can now measure those from a specific urine test to tell whether you're low or high in those brain hormones. I see a lot of people that are depressed that come in and they say, well, I've been taking my SSRI or this antidepressant and it's not helping me. We measure their brain hormones in it by a urine test and find that their serotonin levels are low. So they aren't making enough serotonin for the SSRI to work. It's a blocking. It blocks the reuptake of serotonin, but if there's not any serotonin to block, then the medical effectiveness is not there. And there are supplements that you can use to help your body produce serotonin so that they can be more effective, or in even some cases get off the medication and boost the serotonin by natural means.
You know, one of the things I've learned as I've studied, even in my own career, and I'm a big reader, and there's just certain things that turn me on, and learning about the way our physical bodies work, our what I call our biomechanical units work, is that we are, for lack of a better way to put it, we are electrically charged organic material, right? I mean, I think studies have shown that we are, for lack of a better way to put it, an organic battery, right?
Exactly.
So it makes sense that being able to check in with our electrical waves and starting with our brain waves, be able to determine where we are falling short, where there needs to be a tune-up, per se. Is that the type of service, number one, that you would offer? And the second question right on the heels of that, doctor, is should any person, even those that are feeling fine, should any person go in and also, just for the sake of their own well-being and their own sense of well-being, should a regular person who's feeling fine also go in and get a checkup like this as well, just to make sure that the battery is running right?
Sure, exactly. Those people who are interested in optimal function, I see those people all the time where we look at a battery of tests to help look at what their brain is doing, what their body is doing physically, what underlying chemicals they may have in their body that they aren't really aware of that may be hindering some of their metabolic functions, and then look at the fairly simple ways to correct those either toxins, get them out of the system, if there's been damage done, to correct the damage that has been done. I recently had a person that had played soccer and had chronic migraine headaches and didn't realize it, but on her QEEG, it showed traumatic brain injury.
Wow.
And once she got through a series of hyperbaric treatments, the migraines have stopped, and her QEEG has markedly improved, showing a better connectivity, better function of the brain. So brain healing can be achieved. Brain function can be improved.
Incredible. Doctor, in the last 30 seconds, could you share a little bit about hyperbaric oxygen treatments, because you made mention of that, and we're going to actually have you back in about a month to specifically speak about that as well. But in the last 20, 25 seconds, could you share a thought before we go to commercial?
Sure. Hyperbaric is oxygen under pressure. So you're in a person's in a chamber breathing oxygen that fully saturates the blood vessel. Normally your hemoglobin carries oxygen, but in this case the whole vessel carries it, and you deliver it 10 to 15 times more concentrated to the tissues, which creates healing in all the body's tissues, including the brain. So we get increased brain function, increased muscle function, increased lung and bowel function, even if there's been damage done to those areas.
Guys, we love having Dr. Johnson on the show. We're going to have him back again in 4 weeks. You can get a ton more information by visiting his site, johnsonmedicalassociates.com. Fantastic site, fantastic facility. And once again, Dr. Johnson, we appreciate you being on the show, and we'll speak to you soon.
Thank you so much. Look forward to talking with you again.